everywhere.
All pandemics end. This one isn't over yet.
Manitoba has released its COVID-19 numbers, and although these numbers are underreported, a professor of microbiology says the trend upwards is troubling.
It's been summer. It's still been nice out. We've still been able to gather outdoors. So as we move indoors, I don't necessarily see it declining anytime soon, and we have no idea what's coming next down the pipeline.
Between September 11th to 17th, 87 Manitobans were admitted to hospital with COVID-19. That's up 22 cases from the week prior. 11 patients went to ICU compared to 10 last week. The report from the province states that 2 Manitobans died last week, though the total deaths have gone up by 6, implying other previous deaths now being tied to COVID-19. Dr. Gerstein says these numbers underrepresent what's really happening in the city.
It says, for example, 0 school outbreaks. Well, I happen to know that one of the classrooms in my son's school is certainly experiencing a COVID outbreak. So we don't have the mandatory reporting right now to know what the accurate numbers are, I think, but certainly they're much higher than what is on the official charts.
Winnipeg wastewater data shows an increase in COVID-19 activity, and across Canada, 30% of wastewater surveillance sites are showing a statistically significant increase. Appointments for the bivalent COVID-19 vaccine opened up in Manitoba Thursday. On Wednesday, Manitoba's top doctor said this respiratory virus season is likely to be severe, and Dr. Michelle Dreger, a professor in the Department of Community Health Sciences at the University of Manitoba, agrees.
Certainly going to add some tensions to a system that is already stressed, and hopefully decision makers are looking into strategies to relieve that kind of pressure.
Uptake on booster shots is lagging behind in Manitoba. Dr. Dreger says there could be many factors behind this. She says a lack of familiarity with getting boosters for vaccines this frequently could play a role.
The reality is the virus is still spreading. It can still shift and change because we've got people traveling. We don't have vaccine rates like we see in Canada everywhere in the world. And so this virus is always going to find ways of identifying weak points.
In Winnipeg, Mike Albanese, City News.